helping me a bit kasi he's carrying his own leg. Sige, pagaan ka lang, sasakit katawan mo mamaya. Pag,
Babae mo kayo
pag hindi mo binigay yung bigat mo. Okay? Sige na, ibigay mo na yung bigat mo. Relax ka lang talaga. Relax ka lang, Adel. Okay? Hindi eh.
Mabigat, ma'am?
Bigay mo lang yung bigat mo.
Tutulungan si mama.
Kasi, mamaya, pagtapos nito, masakit katawan mo pag ganyan ginagawa mo.
Hayaan mo lang si mama.
Okay? Hayaan mo lang ako buhatin ka. Yan. Okay? So, cradle it. This is what? Internal. External. Okay. So, when you exercise, you have to do it one by one. Do not one, two. Okay. One by one. This is, okay. 1. Put to neutral. 2. 3. Ang daming tightness niya, Adel. 4. I-click yung bones niya. 5. 6. 7. 8. 9. 10. This is the reason why they thought that we're massaging the patient. But actually, we are exercising them. Okay? Then, external rotation. 1. 2. 3, 4, 5, 6, 7, 8, 9, 10. Okay, relax. How many sets each?
1.
2 to 3 sets. Okay? We just mark only. Lahat po ba? Ikaw na lahat. Okay?
Matulog ka na ba
Next.
eh?
Nakaano ka na, relax ka na.
Pinawian ako ni Ana.
Bawi-bawi na
Okay. Next, we will do hip abduction. Remember hip abduction, right?
Yeah.
Okay, so you just cradle the patient's leg and open it up. So 1, okay, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. 2 to 3 sets. Okay? So, for the adduction, ADD,
Tulog mo.
okay? So, pag adduction naman, this is abduction, di ba? Away. Adduction, okay? I just have to move the patient leg from ear. Okay? Okay. 1, 2, 3. Relax ka lang, be. Sasakit katawan mo talaga. Mamaya ito yung parang pagod na pagod mamaya. Hayaan mo lang ako. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2 to 3 sets. Okay. So, next, ankle rotation. So, we know that ankle rotation is inversion and eversion. So, if this is the foot of the patient, I'm gonna use my fingers to, and the thumb is on top, and I will flip it inward. Okay, this is what? Eversion or inversion?
Inversion.
Inversion. Very good. So, 1, 2, 3, 4. Nagkiklik yung mga tuhod mo. Ay, yung kapaan mo. 6, 7, 8, 9, 10. Okay? Then, eversion is the reverse. So, you have to move it outside. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, after our inversion, we will do toe flexion and extension. This is just very easy, guys. This is flex. Okay? Paano? Okay na ba? Tanggalin natin.
Hindi ako pagod.
Hindi ka pa nag-ulit ko. Sige. Okay? Example, this is the toe. Just have to flex it, okay? Bend it. Okay, 1, 2, 3, 4, 5, 6, 7, 8,
May naiingit.
9, 10. Okay? This is nice if you're normal. But if you're paralyzed and very stiff, this is torture. Because it's not easy. Okay? So to extend, you have to just flip it like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Next. Okay, so we will do stretching. Usually, patients have tightness in the calf muscle, especially if they get stroke, okay, or have injury. That this one get tight. So we will now perform the 30 seconds, okay? So this is called hamstring stretch or calf stretch. You have to put the sole of the patient on your palm, your forearm. The foot of the patient is on top of your forearm. Then you will stretch. You will put your force here and you stretch it and hold it for 30 seconds. So 1, 2, 3. Saan mo nararamdaman yung stretch? Dito, di ba? Sa ilalim. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Relax. And do 2 to 3 sets. Okay? So, if I do the back, I have to do the front as well. The tibialis anterior. Okay? So, I have to stretch this muscle. This is just easy, guys. All I need to do, using the ball of my hand, just push it down. The patient will feel the stretch more on the tibialis anterior muscle. Nasaramdaman dito? So, 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Rest and have to do it 2 to 3 sets. Okay, next, the lumbar rotation stretch. Okay, so sometimes I can cross this to the other side. Ito masarap to Adele. Okay, so we will do rotation. This is first stretch, then later I'll teach you the passive movement. Okay, so we will stretch the patient. Okay, I need to go here. Okay, so you have to stretch from here.
Lagot ang pouch.
Pagpapalagin na lang kita muna.
Put.
Ay, relax. 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 Hindi. Okay, for if you're gonna perform this, guys, make sure relax na yung katawan. The upper part should be okay, the upper part should be straight, and the only one that is rotating is the hip area. Okay, and then you do the stabilization here. Pusod ka na lang, katama ka sa handle. Pusod ka na din. Sige. Okay, so okay, you will start the shoulder. You will stabilize from here. Then you have to push from here. Ay, hindi siya tumunog. Madalas siguro ito ginagawa, no? So, count for 30 seconds. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. So, okay din si Adele. Okay? So, for passive,
Dalawa.
for exercise, we can do an alternate turn. Okay? So, from the middle, you can push this one. So, this is one. Then put it back. Two. Three. The one that I did a while ago is a stretching. If there's a 30 seconds hold, it means stretching. If I just moving it like this is a passive movement. 5, 6, 7, 8, 9, 10. Then you can also do it to the other side. 1, 2, sarap no? 3, pag normal ka. 4, 5,
Tulo na daw, Lord.
6, 7, 8, 9, 10. Sometimes you have to stabilize the shoulder so the patient will not fully rotate his or her body. Okay? Next exercise. Okay? Hamstring stretch. Okay. Let's see if Adele is flexible. There is no tightness. Usually if you have back pain, you have tight hamstring. Okay, for this one, this is a simple stretch for hamstring. Legs are straight, hip are flexed, knees straight. Then you have to pull it up. Okay, your hand will be here at the back of the heel, and then this one can make sure that the knee is straight, and then make sure that the other leg also must be straight. Okay? So if like this, that you will see that the patient is compensating or the patient is trying to bend the knee just for this to go up. So usually we do stabilization. So we put our knee here, then we stretch. Okay? So this is considered what? Okay, si Adela. Okay? Normal range, at least 90 degree. Okay? Then hold it for 30 seconds. Okay? But if you want to put more stretch,
Kaya mo iba yan, ah?
okay, we have to push this down and then move this. Okay? So this will give more stretch to the patient.
Parang
But
palipin lang,
this
ah.
is we do for athletes. Okay? But for stroke patient, I doubt they can able, actually until here only, sometimes until here only, they're already crying, okay? So anyway, for normal, so we just have to push it like this and hold it for 30 seconds, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, then relax. This is stretch. Next, elbow flexion and extension. Okay, if simple, passive exercise, if patient is lying down, okay, for you not to hinder the movement, you can hold the patient hand here at the wrist area and then flex the elbow, okay, and extend. Okay, this is flexion, this is extension. So, 1,
3.
2, mas yung tightness mo sa mga ano,
3,
sa mga
4,
hinge joint. 5, 6, 7, 8, 9, 10. Okay. Next is shoulder flexion and extension. Okay. So we know that this is flexion. We know this is extension. Okay. For flexion, we can perform it. Okay. For this one, if they will, what do you call it? They're gonna hit the headboard. Usually, we have to pull down the patient. Okay. So we bend the knee, and then we can ask the patient, slowly drag yourself down. Okay. Then fix the pillow. Okay. What else? If the patient is paralyzed, you cannot drag yourself out, but you can use.
We love the...
Dapat.
We can use the sheet.
The draw sheet. Okay, so the draw sheet, you can pull the patient down. Okay? Next, still you have to hold from the wrist, assist the elbow, then do the shoulder flexion. So 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. Okay, to perform full range of extension, I have to position my patient into a side lying position. Okay. Okay, Adele, I have to position in a side lying position. Okay, you're gonna turn it to the side and count to 3. 1, 2, 3. Okay, relax. Okay, if I will perform full range of shoulder extension. So from here, I have to move this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, once you're done, 2 to 3 sets. Return the patient. 1, 2, 3. Okay. Okay, next. Shoulder, internal and external rotation. Okay, I have to position the patient's arms like this. Okay, so because he is lying down, so the angulation will become different because he's lying down. But if you're standing, this is your 90 degree.
Yeah.
But if you are lying down, this will be your 90 degree. So if I'm going to perform internal rotation, this is internal rotation.
External.
Okay, so perform it 10 times.
2.
Ang dami mo na, yung hips mo lang yung flexible ha, tsaka yung legs mo. The rest,
5.
Alam na.
6, 7, 8, tumutunog lahat. 8,
Alam
9, 10.
Alam na ang hips.
Okay? Parang exercise na exercise. Agad ha? Okay? So, external. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. Okay. So, next is okay, I'll do this later, the horizontal shoulder abduction, the stretching. I'll do first the finger, okay? So, for the finger, okay? So, it's very simple only. Okay? Flex. So, 1, 2, 3, until 10. And then, for extension, like this. Okay? I can, for the thumb will be different also. This is for extension. Okay? Until 10. So, if you want to flex the thumb, okay?
1, 2,
Like this.
3, 4,
Okay?
5.
Then, extend is like this. Abduction, adduction. Okay? Okay. I'm gonna teach you something. your hand have a reflex. When you flex this, your finger will extend. When you flex your wrist, the normal reaction of your finger is to extend. Then when you extend your wrist, the normal reaction of your finger is to flex. So, if the patient is paralyzed, even now, if you don't control it, okay? So when I flex it, automatic, the finger stretch, and if I extend or dorsal flexion this, it will flex. For patient that have like this, remember stroke patient hand is not normal. They are very what? But stiff. Okay, so what do you think will I perform more? Flexion or extension?
Extension.
Oh. Ayan, ayan na. Ulit ha? Okay, I said, if I flex the wrist, what will happen to the finger? It extends. If I extend the wrist, okay, what happened to the finger? It flex. So, if your patient finger is like this, what do you think the action that I will do more? I have to flex the wrist. So usually it will not open. It won't open, but it will be more soft. It will easier for me to stretch it. And then usually I put it on the bed. I flat it first for a while. Then I will exercise this one by one. Okay? So that is the technique that we do if the patient's hands is contracted. Okay? So we flex it first so the joint will relax. The finger joint will relax. So usually, di ba? Nakakita na kayo ng ibang stroke, di ba? They always like this. Their hands are like this. Okay? So sige, kumari na ganun pa. Okay? It's stiff. So, a technique that I can teach you, flex the wrist, then the joint reflex is to extend. But of course, it won't open because it's contracted. But if I will try to open it, it will be more soft. Okay? Then, extend it to the bed. Okay? Just in case, guys, this is additional knowledge for you. Open it, and then exercise this one by one. Okay? Sinong ganyan sa akin?
Yung asawa ko po.
Ha?
Yung sa kamay, stroke yun 5 years na.
Sana nung bago-bago pa. Pero kaka-contracted na talaga, ha?
Pero nung pag umuwi po ako, di pinapano ko naman sa inyo. Lumalambot siya, kaya pag umuwi na ako dito ulit.
Walang
Wala na, yun nga.
Dapat pa rin araw-araw ba?
Ayaw niyang tulungan.
Okay, so that's the technique that I can teach you, ha? Then flexion and extension, we already did. Okay, now Adele, ano naman tayo, stretching. Sorry, open ko muna si Adele dito. Kasi if the patient is able to sit, ha, we will not do this if the patient cannot sit. Okay? Okay, sit down. Sarap, no? Maging patient.
Dapat
Okay. Okay, so if there's a tightness in the patient's chest, okay, you can only perform this if the patient is able to sit. You cannot perform this if the patient cannot sit. So I think you're quite familiar with this stretch, okay? So, okay, this one is it's called horizontal shoulder abduction, but actually this is a pectoral muscle stretch, which is in the chest. Okay, so you will pull the patient's backward, okay? Then the patient will feel more stretch on the chest muscle, okay? If I want to add on more stretch to it, I can do side like this, and then I stretch the patient. Sarap? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. If not like that, if I'm tall, I can put my, at the back, I can put my knee here. Usually we have a table, bed that is high, that when we sit the patient, we can be level with the patient. So usually I have that one, so I'll do this. Okay, so you can do this kind of stretch also. Okay, so 30 seconds, 2 to 3 sets. Okay, next, the shoulder. Okay, this is the middle deltoid. Okay, so we will stretch from here. So 10 seconds. How many seconds? 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, for the neck rotation. Okay, so if I will perform, okay, so this is the stretching for this one.
Dapat ikaw sa mukha eh.
Hindi ko naman. Okay, hindi naman masarap to ah. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then, neck flexion stretch, lateral flexion stretch.
1.
So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Sige, pag ano ka muna si Ivy, may stretch mo na yung leg niya. So ano na lang natin, kompletuhin na natin para pantay. Okay? Okay? So, relax lang.
Sarap buhay.
Kaya, pagka mag-resist. Okay? So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17,
18.
19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay?
Pangkarami ka na eh.
Para naman sulit yung kanya pag-patient.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yay!
May lakas
May
na
lakas
yan.
Inaansap na siya. Okay? Usually, we do this to patient because they are very stiff because of the immobilization. So, these are just basic actually guys. This is not all yet.
Nakarami to.
Okay? The exercise for that is this. If you will study our book, is this technique.
Sulat ma?
Okay? Sulat na? Okay? Ano oras na ba?
Okay na yun ma?
7:05 ma'am. 7:05?
Dito.